Now, in 2020, as the COVID-19 pandemic swept across the globe, it brought with it an unprecedented level of fear and disruption. While all grappled with the profound communal sorrow of mourning from a distance, a new group of frontline heroes stepped into the war zone, the newly employed universal health coverage nurses. However, they are yet to be employed by the government as the national and governments shift blame over who's supposed to absorb them. And as NTV's Mercy Chelangat now reports, this ping pong has pushed many of them to the precipice.
Amidst the COVID-19 global crisis, 8,571 nurses newly employed under the Universal Health Coverage Program bravely stepped into the front line, battling the highly contagious and deadly virus in the hospital wards. For many, the joy of their first government job was intertwined with crippling anxiety. Assigned to the COVID-19 isolation wards, the nurses confronted the daily reality of gasping patients, exhausted doctors, and the constant hum and ping of medical machines. They provided essential care, holding hands and comforting patients whose families could only connect by phone. However, 5 years down the line, they appear to have been forgotten by the very people they stood in the gap for. Miriam Oer is one of them.
My name is Miriam Oer, a nurse working currently in Ruiru Sub-County Hospital, Kiambu County, employed under Universal Health Coverage. From Sasa 2020 time ya COVID, that's when sisi kama Universal Health Coverage staff, that's when we were employed. We were over the moon kuona sasa tumechukuliwa na serikali.
At the point of employment, she signed a 3-year contract from May 2020 to May 2023. However, she says that when the contract expired, there was no clear communication about what would happen next. Eventually, the contracts were extended for a year with a promise of absorption into permanent positions.
Remember, we are doing the same work these permanent and pensionable people are doing. And sometimes they look down upon you because you are young, and bado they feel that you're supposed to work more hours than them. Remember, hatuna any allowance, hatuna risk allowance or anything. We are only entitled to only 30 days month leave yearly. We don't have any other benefit. So that's when we fall into depression and anxiety. In medical field, we have this what we call the mental status score, mental assessment. In a score, kuna yenye score inaonyeshananga if you are mentally ill or you are not mentally ill. So in the score venye nime assessiwa wanasema niko mentally ill. Ebu imagine you're working with your colleagues, working the same working environment and everything, but wewe huwezi hata kusustain familia yako, huwezi hata kulea watoto wako. So sometimes you even regret why you entered into nursing. Ili ni stress, ili tumadi nikasikia me I think I can give up. Me hata ilifika tu mahali nakumbuka nilikuwa na hii dawa ya kunguni, nasema ama niikunywe, then naangalia naona sasa nini nikiikunywa alafu niikunywe nikose kukufa. Nilikuwa naomba tu kama mtu anaweza lala na siamke. At least 5 have died because of suicide. Yeah. Okay. Yeah. Wengine wanajidunga mashindano.
Do you know any person?
Yeah, tunajua. Mwenye tu amejidunga shindano na ameenda, family itaki maneno mingi, so ina cover up.
Immaculate Njoki, also a UHC nurse, recalls that upon employment, she and her colleagues were placed on a consolidated salary plan of 50,000 shillings, which has remained unchanged to date and is subject to income tax and other statutory deductions.
Kulikuwa na ile tax relief, then ikarudi. So unakatoa a whole 7,000, alafu unakatoa NSSF, which has since never been remitted. I don't even know. The last time I checked last year, sikuwa nimeremitiwa NSSF. NHIF unakatwa, then iliongezewa, then tukaintroduce your house levy, still on our payslip. Then kuna mtu ako na HELB, then kuna mtu ako na loan. So at the end of the day, there's a payslip that comes to around 11,000. That is what you're getting.
When Aden Duale took the reins at Afya House, he promised to resolve their issue within 3 weeks. However, instead of a resolution, he issued a circular seconding them to counties with stipends. There has been no further communication regarding permanent and pensionable employment terms or when their gratuity will be cleared. Emmanuel Kiluyi, another UHC nurse, explains that most of the deployed staff found themselves in rural facilities that were often inadequately staffed or well supplied with medical equipment, forcing them to handle patients in less than ideal circumstances. These powerful testimonies show the irony of a nation striving to achieve universal health coverage while its essential healthcare workers are overworked, underpaid, and neglected. It also brings to question the wisdom of a government that prioritizes renovation of State House buildings while its critical care workers break in half. Mercy Chalangat, NTV.